basically all the seasons in male and female ferrets are governed by either estrogen, progesterone, or testosterone, and the hormones for those are ruled and governed by the adrenal glands, which sit on top of the kidneys. Now, if you're not allowing, by removing the uterus, by removing the testes, you're then cutting off the supply of these hormones, which causes the adrenal glands then have a major problem and can become diseased. It is a cancer, but it's a very, very slow growing, very easily treatable cancer. So it's not one that you would necessarily want to give too much worry to. So they've linked this adrenal disease to neutering, and one paper I was reading earlier actually doesn't seem to think that the timing of the neuterings, i.e. very early in America, 4 to 6 weeks, or later, 6 months plus in this country, actually makes too much difference to the overall incidence. So timing doesn't seem to be so much of an issue. There's also the big issue of light, because daylight hours also control the ferrets' reproductive cycles, and ferrets that are living indoors that are subjected to a lot of artificial light that can cause havoc again with the hormone production. So that's been linked as well. Again, in this country, if the ferrets kept outside, they seem to be at less risk. So it was because of the increase that we're seeing in adrenal disease that, I say, all the research was being done, and the recommendations and guidance was set about.
Mm-hmm. Mm-hmm. So when you say these recommendations and guidance, was that from the Royal College of Veterinary Surgeons? Mm-hmm. Is that where it comes from?
Yeah. And
advising the government, or is that just from the surgeons?
No, it's just because the vets will work from guidance from their governing body, from the vet school. So, and also from things that have research papers, they can decide for themselves. They've read enough research on something that they don't think it's a good idea to do it.
So do they take the guidance from the Royal College, but they don't have to necessarily enforce it? It's more of a guidelines.
Yes.
Right.
Yeah. But it's up to them, because also then you've got to defend it.
Right.
So from a legal point of view, if you're ignoring guidelines, you've got to justify why, or potentially you might have to justify why. So some vets may think that it's better just go with the guidelines, go with the guidance.
Mm-hmm.